There's about a 50,000 bed capacity that has to be increased. It has to be increased in the existing hospitals. We're planning to cancel all non-critical elective surgeries. We have also instructed all the hospitals to maximize capacity. With the more beds, you need more staff. So we're going to nursing schools, medical schools, asking retired doctors and nurses to come back into service. Supplies are a major issue. Product providers, all companies who are in this business, we will pay a premium for these products. If you are a business that doesn't manufacture these exact items, but if you have equipment and personnel and you believe that you could manufacture these items, we will give you funding to do it. Any business that's interested should contact Empire State Development Corporation. Any company that wants to sell product should contact my office, the Executive Chamber, Simonita Subotic, at that number. But if you have masks, offices that are non-essential right now, we need those masks, those gowns, gloves, and we need them now. In terms of building more beds, as I said, we've had the Army Corps of Engineers here, and we're working with them. We're looking at a possible number of locations for large temporary facilities. Javits Center, number of CUNY sites, number of SUNY sites. St. John's University wants to be helpful, Fordham University. So we're looking at all these sites, and they're all under analysis. It's ventilators, ventilators, ventilators. That is the greatest need. We're notifying any health department in the state. If you have a ventilator and you are not using it at this time, or it is non-essential to your use, we want it. If you are a regulated health facility, we are asking you by order of the Department of Health to make that ventilator available. We will purchase it from you. You could lend it to us, but we need ventilators. And anyone who has them now, please call the New York State Department of Health at that number. On the valve, we reduced it to 50% of the workforce. We then reduced it to 75% of the workforce must stay home. And today we're bringing it to 100% of the workforce must stay home. These are non-essential services. Essential services have to continue to function. We also have specific rules for people's conduct. First is for what we call the quote-unquote vulnerable population, seniors, compromised immune system, people with underlying illnesses. Where are the places we're really worried about? Nursing homes, senior congregate facilities. Remain indoors, go outside for solitary exercise, pre-screen all visitors and aides, don't visit households with multiple people. Vulnerable persons should wear a mask when in the company of others. To the greatest extent, everyone in the presence of a vulnerable person should wear a mask. They shouldn't be on public transportation unless it is urgent and absolutely necessary. For non-vulnerable populations, these are the rules. No non-essential gatherings. Any concentration of individuals is because you're an essential business and an essential workforce. When in public, social distancing at least 6 feet. Outdoor recreation is a solitary recreational exercise. Sick individuals should not leave their home unless to receive medical care, etc. Young people need to practice social distancing, avoid contact with vulnerable populations. Precaution. Alcohol wipes. These are legal provisions. They will be enforced. There will be a civil fine and mandatory closure for any business that is not in compliance. You look at some of these videos that are going around and some of these newscasts on what young people are saying. I can't get it. Yeah, that's wrong. That is wrong. Well, young people can't get it. That is wrong. It's just not a factual statement. 20% of coronavirus cases, according to CDC, ages 20 to 44. Okay? France, more than 50% of the coronavirus patients in ICU under 60 years old. You can get it. Well, I can't transmit it if I'm not symptomatic. No, you can transmit it if you're not symptomatic. Even if you're young and strong and everybody's Superman, Superwoman, I can deal with it. Oh, yeah? You can give it to your grandparent, you can give it to your parent, and you can put somebody else's life in danger. Total positive up to 7,000, 2,900 new positive cases. We have the testing so high in New York right now that we're testing per capita more than China or South Korea. We have tested 32,000 people. We did 10,000 tests last night. The rate of hospitalization, watch this number, it's 18%, 1,200 out of 7,100. We're all in quarantine now. I mean, think about it. We're all in various levels of quarantine.